typically the earliest time that when we recommend having patients come into our office, children come to our office, is 6 months from the time that their first tooth erupts. And that can vary for different children. I think the average age is about 6 months when a child gets their first tooth. And so usually around age 1 is when we see a patient for the first time. And we'll do a risk assessment, and depending on that, the child may need to come back in 6 months, but a lot of times we won't see that child for a year or so until more of the teeth have come in. And that first visit usually has a lot of us going over anticipatory guidance with the parent and talking to them about pitfalls that people can fall into that cause cavities. We'll also, we've had infants come in where we talk to the parent or where they're concerned about feeding, and talk to them about the frenum tissue that can sometimes interfere with that. So we'll see children, as old as a week or two, but I think on average, the first time, you would have your child come in is around age 1 or so to see the pediatric dentist.
When those teeth first start coming through, a lot of questions that we get revolve around how to care for them, and is it painful? And sometimes teething can be a fairly uncomfortable process, but it's normal and we all have to go through it. But some things that help, anything soft that a child can chew on, of course, provided it's clean and safe to chew on. Even the handle of a toothbrush, or a soft teething ring that you can find at the grocery store is very, very helpful. And when those teeth come in, it's important to brush them. And lots of times parents will ask, well, what do I brush with? And there are lots of fancy things that you can find online, but really the very best is just a regular toothbrush. Just a small-headed, soft-bristled toothbrush is the very, very best thing. And we, of course, have those in our office. You can find them in lots of different places. So we recommend brushing the teeth from the first time that they come in. And sometimes this will be unfamiliar to parents, or they may be a little uncomfortable, wondering if they're, hurting their infant, because these teeth are usually coming through about 6 or 7 months of age. That's average, and sometimes it's much later than that. So it's good to start brushing those from the very beginning.
Yeah. You mentioned the teeth coming in, and a question we get a lot from parents is, they'll call us and say, my kiddo doesn't have any teeth yet. They're 1 year old, or they're 1 year old, and we haven't seen anything. Do we need to be concerned? And our usual answer is no. But around age 1, it's a great time to bring them into the dentist so we can check those things with their teeth. When we would be concerned from a dental standpoint and maybe want to take x-rays, if they don't have any teeth by age 18 to 24 months, then we may be concerned that something could be going on, interfering with the eruption of the teeth, possibly missing teeth. But those are things that we could catch early on when the patient comes in for their first visit.
Another question we get a lot is, when will baby teeth start falling out? And believe it or not, we actually get this question more from kids than we do from parents, particularly as they start kindergarten, and some of those early bloomers start losing teeth, and it seems like it's a rite of passage in kindergarten and first grade. Who's lost teeth? Who's lost the most teeth? But the average age to start losing teeth is right around 6, and it's the 2 lower central incisors. Everybody recognizes when the 2 front teeth on the top are lost, but that's usually not until age 7. So anywhere from about 2.5 to 3 years of age is when all the teeth will come in, except in rare circumstances that Dr. Gustafson just mentioned. But by age 6, they're starting to loosen up and fall out. Of course, some kids won't lose the first tooth until 7 or 8. And it's rare that there would be a problem if that is the case, that they're losing them later. And other kids will start losing them around 4 or 5. So 6 is nothing more than an average. And then they will keep their teeth and usually lose the last one around age 12. Again, in some cases, kids will be all done with their baby teeth by 10, and in some cases not till 13 or 14. But on average, 6 to 12 years of age is when those baby teeth are falling out.